Atrium, taking healthcare to new levels with innovation in medical device technology. Our unmatched quality, constant innovation, and commitment to education and support have made us the #1 manufacturer of chest drain products worldwide. Atrium's Oasis Dry Suction Chest Drainage products are designed to let you devote more time to your patients and less time monitoring equipment. Chest drain setup has never been faster and easier, especially with the adjustable dry suction regulator and prepackaged water seal ampule. Atrium's collection chamber graduations are the best in the industry, with big, bold, easy-to-read numbers and large writing surfaces. Each collection column is clearly defined, so changes in patient fluid volumes are easily detected and recorded. Tracking your patient's progress, such as following an air leak or simply observing changes in intrathoracic pressure, is now easier than ever before. Atrium's advanced water seal, with its graduated air leak monitor, blue tint water, and calibrated pressure level column, significantly improve monitoring important patient conditions, such as changes in intrathoracic pressure and trends in patient air leaks. Atrium produces a complete family of Oasis dry suction water seal chest drains with the same familiar operating design. Each model is uniquely tailored to suit a distinct patient need or clinical requirement following emergency chest trauma, thoracic, and open heart surgery. For the protection of you and your patients, Atrium's entire family of Oasis chest drains are 100% latex-free. Each Oasis dry suction chest drain comes packaged in high-quality CSR wrap to ensure maximum product sterility. Detailed multi-language operating instructions are conveniently provided with each unit and are also made available on Atrium's website. Let's review these instructions and see how fast and efficient Atrium's Oasis chest drains are to set up and use. First, remove the CSR wrapped unit from the outer bag. Carefully open the CSR wrap using sterile technique and enter the unit into the sterile field. Each unit comes equipped with a large, easy-to-grip handle that makes handoff and patient transport easier and safer than ever. The sturdy swing-out floor stand should be opened for setup convenience and for placement onto the floor. To begin, fill the water seal to the 2-centimeter line with the 45 milliliters of prepackaged sterile water provided with each drain. Simply remove the prepackaged sterile water ampule from the back of the drain, twist off the top, and insert the tip of the water ampule into the suction port. Empty its entire contents by squeezing the ampule until all the water empties into the drain and fills the water seal to the indicated fill line. Discard the ampule. Next, connect the chest drain to the patient by inserting the patient tube connector directly into the thoracic catheter. The patient is now on gravity drainage or to water seal. To apply suction when prescribed by a physician, connect the suction source vacuum line directly to the chest drain's suction port located on the top of the drain. Turn the suction source on and increase the vacuum to at least -80 millimeters of mercury or higher. A suction monitor bellows provides visual indication of sufficient operating vacuum levels for best performance. The suction monitor bellows must be expanded to the delta mark where indicated or beyond for a standard -20 centimeters of water or higher regulator setting. Visual expansion of the bellows across the suction window will confirm adequate suction operation. The Oasis suction regulator is preset to a -20 centimeters of water suction pressure level directly out of the package. Suction pressure can be adjusted to any desired pressure level, between -10 centimeters of water and up to a maximum suction pressure of -40 centimeters of water. Changing the regulator suction control setting is easily done by adjusting the rotary suction control dial located on the side of the drain. Simply dial down to lower the suction pressure setting and dial up to increase the suction pressure setting. When changing from a higher to a lower level, use the manual high negativity vent located on top of the chest drain after regulator adjustment to reduce excess vacuum down to the lower prescribed level. As with any chest drainage system, the drain must be placed below the level of the patient's chest and kept in an upright position to maximize drainage efficiency. We recommend hanging the unit bedside using the multi-position hangers provided. The integrated flexi hangers accommodate today's newer bed designs and allow single hand placement and transport. All patient tubes, and suction connections should be routinely checked to ensure proper leak-proof operation and chest tube patency. Like all Atrium models, the Oasis 3600 single drain collection chamber incorporates a large writing surface with big, bold numbers and easy-to-read fluid level graduations. The first collection chamber column is calibrated in small 1 ml increments up to 100 milliliters in brightly colored bold numbers, then in 2 ml increments up to 200 milliliters. Subsequent collection chamber columns are calibrated in 10 ml increments up to the maximum drain capacity of 2100 milliliters. Depending upon your hospital's preferred sampling technique, samples of drainage fluid can be taken directly from the patient tube by forming a temporary dependent loop and inserting a 20-gauge or smaller needle with syringe at a shallow angle. On selected models, samples can be taken directly from the needleless Luer lock sampling port located on the patient tube connector. A water seal is a simple one-way valve which allows air to exit the chest and prevents air from returning to the patient under normal conditions. It's also a very useful diagnostic tool, as it can show even the smallest trends of an air leak, as well as changes in intrathoracic pressure. Assessing patient air leaks is easy with Atrium's blue tint water and graduated air leak monitor. Continuous bubbling observed in the water seal will confirm a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with gentle float ball oscillation will confirm the presence of an intermittent air leak, and no bubbling with minimal float ball oscillation at the bottom of the water seal indicates that no air leak is present. Bubbling from right to left in the air leak monitor must be present to confirm an active air leak. The Oasis Graduated Air Leak Monitor allows visual detection of air leaks from a low volume of 1 to a larger air leak volume of 5. Air bubbles passing through the Graduated Air Leak Monitor help the clinician assess air leak patterns and patient air leak trends. Changes in intrathoracic pressure can be determined by observing the level of the blue tint water and float ball in the calibrated water seal column. Atrium's blue tint water and float ball make changes in patient pressure easy to monitor, even in low light conditions or from a distance. When the system is connected to suction, patient intrathoracic pressure will equal the suction control setting plus the float ball water column level. For gravity drainage applications, patient pressure will equal the float ball water column level only. Each Atrium Oasis chest drain incorporates an advanced high negativity float valve, which is located at the top of the water seal chamber. During normal or deep inspiration, Atrium's float valve will allow thoracic patients to draw as much intrathoracic pressure as they may require during each respiratory cycle. However, during prolonged periods of accumulating vacuum pressure, the float valve will automatically lower high vacuum pressure down to a safer, more desirable level. Atrium's unique controlled release valve design safely and automatically protects your patients against prolonged exposure to excessive negative pressures, which can accumulate as a result of repeated patient tube milking or stripping. To manually lower the height of the water seal column when connected to suction, temporarily depress the manual vent located on top of the drain until the blue water column lowers to the desired level. It is not recommended to depress the manual vent when suction is not connected or not operating. When monitoring a patient's chest drainage system, it's important to periodically check the water seal's operation and fluid level. If the water seal is either underfilled or overfilled, it should be adjusted accordingly to the prescribed maximum 2 centimeter level. Using a 20-gauge needle with syringe, adjust the water level via the grommet located on the back of the water seal chamber. In the event of an accidental knockover, upright the drain immediately and check all fluid levels. If required, the water seal level may be adjusted back to its original 2 centimeter level as previously demonstrated. If a knockover does occur, fluid drainage could potentially spill from one collection column to another. If this occurs, gently tip the drain to the right to return fluid back to the correct column and then upright the drain. The Oasis features an advanced water seal design for maximum knockover protection, even when connected to suction. In the event of an accidental knockover, its knockover nozzles helps minimize interchamber spillover for the ultimate in system reliability, user convenience, and patient safety. Most healthcare facilities routinely use suction for their patients as it helps improve the rate and flow of fluid drainage from the patient and out through the thoracic catheters. Suction also helps increase the rate and volume of airflow out of the patient to help maximize full lung expansion and stabilize breathing dynamics. Atrium's radial control suction regulator continually adjusts for changes in patient air leaks and fluctuations in hospital wall suction, providing the utmost in patient safety and system reliability. The highly visible suction bellows readily confirms suction operation in low light or from across the room. If the bellows is observed to be expanded but less than the delta mark, the suction source vacuum pressure must be increased to at least minus 80 millimeters of mercury or higher. For a regulator setting less than 20 centimeters of water, any observed bellows expansion across the window will confirm suction operation. The bellows need not be expanded to the delta mark for suction pressures less than minus 20 centimeters of water, just visibly expanded in the window to confirm suction operation. For patient transport and gravity drainage applications, simply disconnect the suction source vacuum line from the suction port. As a safeguard against tension pneumothorax, a fully automatic positive pressure release valve opens instantly to release excessive accumulating positive pressure when such clinical conditions may arise. Its unique tamper-resistant design is located in an obstruction-free area on top of the drain. Selected Atrium Oasis models come equipped with a locking inline connector and removable patient tube clamp that provides convenient, simple disconnection after use, or rapid inline ATS blood bag attachment when required. The patient tube slide clamp must remain open at all times during system operation. It's recommended to position the patient tube clamp next to the inline connector for setup convenience and routine visual check. The patient tube clamp can be removed if desired. Handling and disposal of a discarded chest drain and its contents should be in accordance with all applicable regulations and approved hospital infection control standards. As you've just seen, a chest drainage system provides a means for removing air, blood, or fluid from the pleural space or mediastinal cavity. To better understand how a chest drain works and contributes to a patient's recovery, let's review the chest's anatomy and physiology and the mechanics of breathing. The chest wall is composed of the ribs, sternum, and thoracic vertebrae. All are interlaced and covered with intercostal muscle to form a semi-rigid structure. The lower boundary or floor of the thoracic cavity is known as the diaphragm, which is also composed of muscle. The interior of the thoracic cavity can be divided into 3 distinct areas, the mediastinum and 2 separate chambers for each lung. The inside of the rib cage is lined by a membrane called the parietal pleura, while the lungs are covered by another membrane called the pulmonary or visceral pleura. Under normal conditions, these 2 pleural surfaces are closely held to one another, being separated only by a very thin film of lubricating fluid called pleural fluid. The pleural fluid keeps the 2 pleural surfaces in contact while allowing them to slide smoothly over one another during breathing. The presence of negative pressure, or vacuum, between these 2 membranes is what helps hold the visceral pleura in close contact with the parietal pleura at all times. During respiration, air moves in and out of the lungs in response to changes in intrapleural pressure caused by movement of the diaphragm and chest wall. Under normal conditions, there is always negative pressure in the pleural cavity. The degree of negativity, however, changes during respiration. When air, fluid, or blood enters the space between these 2 membranes, the space created is known as a pleural space. This is an abnormal occurrence and results in labored breathing. When the chest wall is opened, either by surgery or chest injury, the inrush of air causes the vacuum in the patient's pleural cavity to escape. Since the normal negative pressure or vacuum is no longer present, the lungs may partially or fully collapse, as they depend upon this negativity or vacuum to stay fully expanded. Without full lung expansion, the patient experiences pain and great difficulty in breathing. If air accumulates in the pleural space and has no means to escape, pressure within this space can rise significantly. This is known as a tension pneumothorax and can result in a potentially life-threatening situation known as a mediastinal shift. That's where the chest tube and chest drainage system come in. To restore the chest to its normal condition, all air and fluid must be removed. The purpose of any chest drainage device is to help reestablish normal vacuum pressures by removing air or fluid in a closed one-way fashion. For pneumothorax, the chest tube is typically placed anteriorly near the lung's apex. For a hemothorax or pleural effusion, the chest tube is placed more laterally in the lower part of the chest to facilitate more efficient fluid drainage. Frequently, 2 catheters are inserted. The need for chest drainage is also required following open heart surgery or chest trauma to evacuate any pooling blood, which, if left in the mediastinal cavity, can cause cardiac distress or tamponade. As you can see, chest drainage is indeed a life-saving procedure and one of the most important services a physician and nurse clinician can render. It's our hope that review of this educational video has helped enhance your working knowledge of chest drainage and further familiarized you with Atrium's dry suction operating system. By working hand in hand with leading-edge nurse professionals such as yourself, Atrium will continue its quest to improve patient care with superior quality chest drainage products and professional clinical education for all of your chest drainage needs. If a question or need arises for customer service, product information, or to request in-service educational material, we invite you to email us, call, or fax Atrium's hotline anytime, or visit our website at www.atriummed.com. From all of us at Atrium, thank you for letting us provide you with this important educational service.